You are watching the DocTalk show.
Talking about epilepsy with our doctors in studio, our neurologist, Dr. Idro Richard and Dr. Musubiri Abdul. They are experts in the field of epilepsy, and this is the topic we're discussing today on the DocTalk show. Before we went for the break, we discussed what epilepsy is and how you can identify someone who has epilepsy by manifestation of the presentations can either be in the convulsive state or in the non-convulsive state. So now I want to understand what exactly causes epilepsy and how it can be prevented. So perhaps I'll start with you, Dr. Idru, because I imagine the causes in children may be different from the causes in adults. So we'll start with understanding epilepsy in children. What exactly causes this condition of repeated convulsions?
Thank you, Darius. Now, in understanding the causes of epilepsy, epilepsy, the distribution is such that the most common group affected are the young children. And beyond the very young childhood ages, the number of people affected or the prevalence reduces until when, during old age, when you see the prevalence increasing. In young children, some of the leading causes are problems which children are born with. So during, when the child is still in the womb, as the brain develops, the brain may develop with some malformations. And in these malformations, the brain connections, the connections of the different cells may be inappropriate, or they may make contact with the wrong areas. And these children are prone to getting seizures, and the recurrence of the seizures, of course, leads to epilepsy. Two, during pregnancy, some mothers may get an infection, and this infection may go and enter the womb and affect the brain of the babies. And such babies, again, have a high risk of epilepsy.
Could these be infections like syphilis?
It may be syphilis. It may be some viruses. There are lots of viruses in the environment. We call some of them we call them cytomegalovirus. The herpes groups of viruses which tend to invade the brain. But also there are some parasites which are like toxoplasmosis, which we even get from in cat or dog feces. They may affect the mother and go and affect the brain of the baby.
Okay.
Now, then the next one are the causes are during birth. So mothers who experience a difficult birth and where the baby really struggles coming out and lacks sustains brain injury from either lack of oxygen or a prolonged labor. Many of these babies sustained injuries, and these injuries may later in life predispose these babies to epilepsy.
Okay, so they're mainly like conditions, like you explained them, the congenital, meaning a defect, a baby is born with a defect in the brain.
So in the development of the brain, the first step, 2, infections while the baby is still in the womb. 3, injuries during a difficult birth. And then 4, after birth, we have other infections like meningitis. Sometimes either in the newborn or in the first few months of life, babies can get infections like meningitis or cerebral malaria. Those ones may injure the brain, and children may get epilepsy.
The recurrence of these seizures.
Yes.
Okay. Dr. Musubiri, we've understood some of the causes in children. Could they be the same as the ones in adults?
Just to take it on from where Richard has stopped, we still go by age group. The younger age groups, we are talking about maybe adolescents, if they didn't have this epilepsy during childhood, the risk factors could be infections as well, infections of the brain and the coverings of the brain. We also talk about trauma, accidents. We know these are experimental years, risky years. We ride bicycles anyhow or riding motorcycles.
So those are accidents like head injuries.
Head injuries. But also, if you get into sports, some contact sports can be risk factors. Especially if you get an injury that makes you lose consciousness for a bit of minutes, maybe more than 30 minutes, it can risk you to stroke. As we grow older, we got the older age groups, we still talk about infections. Infections are almost throughout life. We talk about brain injuries, but in the older populations, we start seeing more of strokes as causes of epilepsy, and we also start looking at tumors, cancers of the brain as causes of epilepsy. So in adults, when we get a person having a seizure for the first time, people mainly above 50 years, there's an age group where we will try to look out for anything which is maybe preventable, but we need to investigate more to find out the cause. Most of the epilepsies which have no cause, or what we call idiopathic epilepsies, start early, start in childhood. Most of the familial epilepsies start early. But
and
when
they might have some connections with genes and family histories.
Yes, but when we start getting a first seizure, when you are old, maybe over 50 years, then we start thinking maybe there's something we need to work out even more.
Okay.
And indeed, in children, although we had mentioned so many different causes, there are quite a number of them in which we do not know the cause. And in the majority of those cases, actually it is genetic, it's in the gene, mutations in the gene.
So now that we've understood some of these causes, the most important question would be, is there any danger if epilepsy is not treated? We know it can arise from all these causes I've talked about, can present in children and in adults, but what could go wrong if the person is not treated?
So before we go to treatment, we first of all need to identify who has epilepsy. I would want to emphasize one thing. The best way to diagnose epilepsy by a health worker is from the history of the patient, but most importantly of the caretaker. There are a number of investigations which are done, but I just want to emphasize, we do sometimes what they call encephalography, EEG. That test is not so much sensitive, and many people sometimes come to the table and say, I'm told I have epilepsy, but my EEG is normal. We should understand the limitations of that test. The best way to diagnose an epileptic is from the history of the patient and the caretaker. Epilepsy can be treated in several ways. We know we can give drugs which can control the disease in many of the patients. In the adult populations, we believe that 7 to 8 out of every 10 people can be controlled on drugs.
And to mean control, meaning they'll never get seizures.
Once they're on drugs,
they are cured.
They are taking the drugs, they will be controlled. But of recent, there are recent developments. There are a number of technologies. Sometimes they can put devices in the body to control seizures. That technology may not be here as yet, but that is possible. And sometimes they also do other epileptic surgeries to kind of stop seizures, especially in patients who are not responding. But to go back to the question as to what can happen when you don't treat epilepsy, we know one of the biggest ones is death. And death can come from either prolonged seizure, because during a seizure, there's arrest of blood supply and then breathing, all those things are compromised. So you can actually get problems, you can die. We also have what we call SUDEP, sudden death of unexplained, in epileptics, people can die because also their hearts kind of get compromised. There's an assumption that
during the phase of the abnormal electrical
Yes, during the phase of the abnormal electrical activity. Then we also have the common ones, like we have the injuries from burns, they can get fractures from the falls, and then they can also get head injury, they can hit their heads very terribly. And then we also have cognitive impairment. Sorry, there is slowness of thinking or
in the
mental
intellectual development
retardation
of the
from the repeated seizures.
Um,
Just to emphasize that children should be treated early to prevent most of these, because the child brain is still growing, and when you don't manage it at that moment, we often get a number of people coming in the adult phase when they are completely mentally incapacitated because they have had repeated seizures which have not been controlled.
Okay, so talking about children, Dr. Idro, are these what Dr. Musi was explaining, the sudden deaths, the falls, the accidents, are these also, do you commonly see these in children if they're not treated?
The same does occur. Again, in children, we can control or say cure epilepsy in 7 out of 10 children. So if there are 10 children who present with new onset epilepsy, with the available treatments which we have, we can actually control this epilepsy and eventually take off some of these patients off treatment after we have controlled the seizures. And these treatments are available throughout the country from health center 3 level. It may be some of the basic medications, but they are available. But for some specific types of epilepsy, like the absences, the patients may require to go to the slightly higher centers.
The higher hospitals.
Higher hospitals.
Okay.
And if the epilepsy is not treated, if epilepsy is not treated, as Dr. Abdul mentioned, these children may have cognitive decline, they may not attend school, they may not achieve their developmental, their normal development and participate like other children. Many of them may get injuries. You have children who have so many burns and so many injuries on the face, and of course, both them and the family really get stigmatized.
Okay. So we have understood some of what can go wrong if someone with epilepsy is not treated. They can sustain lots of injuries. They can get significant impairments to their social lives. Some are stigmatized, some are unable to go to school, some are not able to work. And the sad bit is they are very prone to accidents and deaths. So epilepsy, what we're saying, it's a very severe disease of the brain, and that's why we're having this discussion on the DocTalk show to create awareness about this condition and to let people know that if someone has epilepsy within your family, you should take them for adequate treatment with the right, within the, you said the treatments are available in all the health centers, down to Health Center 3. So take them to the hospitals and they receive adequate treatment so that we can prevent lots of these complications that arise with epilepsy. So after the break, we shall come back and discuss exactly how to take care of someone who has epilepsy. That is when they are when they're having a seizure or an attack, and if they're not having an attack, what you can do to them, and how you can prevent epilepsy from happening again. So send your questions, your comments to our social media platforms on Facebook, Twitter, and you can also log on into our YouTube pages to watch these videos and discussions about epilepsy and so many other conditions.
You are watching the DocTalk Show.